By participating in research, you help us doctors and scientists answer the big question. Your involvement helps us to come up with real-world solutions to make healthcare better for everyone.
Welcome back. I just wanted to start with a couple things. So my name is Brahmaji Nalmothu. I'm a cardiologist here at CHU Medicine and one of the co-directors of Precision Health. Been really privileged to work with the program over the last several years, actually since its inception in late 2017, and then been able to kind of work in the leadership role over the last couple of years. And I just wanted to take a moment on the second point to echo what Salim had said, as well as the provost said, and many of the speakers, really to just say thank you for coming. It's really just remarkable to see everyone here, to see what you all represent, and just the impact you've had. I know we're all like still, the talks this morning were wonderful, and Tom's description of the impact that this has on healthcare and improving outcomes is just so direct and so concrete, and I can't say that enough. And it really just starts with the volunteerism. For you guys to be able to give your time and effort here is just, it's really a privilege. And we have to figure out a way to have not only a participant recognition, but to bring all of our early career faculty to meet you all, because I think you guys inspire their work in a way that is very difficult to describe. So with that, I wanted to tell you it's a real pleasure for me to kind of have this next section, which is a panel with three friends, as well as participants and collaborators. And these are three people that have a direct connection to me. I'm always so excited when I talk with them. We had a great prep session yesterday just to kind of figure out how we're going to put this all together. And I just, it was just amazing to just even spend those 30 minutes just talking about what we're going to talk about. So I'm really excited to have them here. I'm going to have them kind of introduce themselves a little bit as well. I think they'll do a much better job than I could. And we're just going to go down the road. So Lori, do you want to start a little bit?
My name is Lori Robertson. I work for Precision Health. I am their administrative specialist. I am 57 years old. I am married with 4 kids.
Barton?
Hi, I'm Barton Failer, and I live in Ann Arbor, and somehow got involved in the study. I guess we'll talk about that later. But what was really interesting when I read my study information, the person handling it was Brahmaji. We have dogs from the same litter, so our dog families get together. And I'm 62 and have had some heart conditions, which probably got me into this. So thank you.
Good morning. My name is Reverend Dr. Sarah Bailey, and I serve in multiple positions here. I am a community activist in Flint, retired 15 years. However, I don't think I'm really retired. I work just as hard as most of you who are still working work. I am the CEO of an organization in Flint, Michigan called Bridges into the Future. I work with several different other organizations, including the Flint Public Health Youth Academy. I am the community lead for the Michigan Institute for Clinical Research, and I am a participant. I believe that my input in research as a participant, as a collaborator, is vital and extremely important. And I think, Dr. Valley, you emphasized that very clearly to us this morning, that without people of color, other people groups in these research studies, that many things would be missed, and we will be prescribing things for people that don't work on them. And that is the reason why I basically got involved with research after 40 years as a clinical therapist. Decided to do this. I think I'm kind of crazy too. By the way, I have 4 children, I have 10 grandchildren, and I have 6 great-grandchildren.
Wow.
So I am grateful to be here, and I'm a long COVID survivor.
We're never going to let Reverend Bailey retire, just to let you all know. So, all right, so we're going to start by you guys sharing a little bit about your own relationship with research, what drove you to it, maybe some of the fears you had, just to give folks a sense. Lori, do you want to start with where you came from?
Sure. So back in 2018, when I was 51 years old, I was diagnosed with bile duct cancer. My entire medical team is here at Michigan Medicine. Luckily, I do have an amazing oncologist who specializes in this type of cancer. I was eligible to have a Whipple surgery procedure. I had that done November 2019. It's been almost 5 years. I did 6 months of chemo of Xeloda and capecitabine, and then I was clean for 2.5 years. July 2021, unfortunately, I had a reoccurrence show up on my MRI of my abdomen, and I had this metastasis in my peritoneal lining. At that point, Dr. Sahai said the prognosis was very poor. I was 55, and he thought that I had about a year to live. However, he had a phase 1 clinical trial that I could enroll in. So my husband and I briefly discussed it. We kind of knew that it was now or never, do or die. And so I did enroll in this phase 1 clinical trial. That the chemo, in addition to Gemzar and cisplatin, that there was be a trial drug of Devonstat that was added to my regimen. So every morning I spent 12 hours in the chemo chair with this study drug, and very luckily I had a complete response. I was eligible then for HIPEC surgery, which is where they remove the tumor and they insert heated chemo directly into your abdomen. I was hoping that that would kill any microscopic cells that were left behind from the surgery, and I have been clean now for almost 18 months. So with any type of, I think, study, there's always a fear. For me, the fear was that it wasn't going to work. Not everybody is eligible. You have to meet certain criteria. You know, again, I got very lucky. I have an amazing team behind me. So without all of you out there participating, I possibly wouldn't be here today. So it really is a personal feeling for me, and a deep, heartfelt thank you to all of you who have participated in studies. So I think what gets lost in a lot of this is you kind of forget that how important some of these studies are. My study is now in phase 2. It's doing very well. I just talked to a gentleman on a Facebook group who is also taking the Devonstat, and he also has a complete response. So I know 3 people now that have had a complete response to this drug. Any type of gastric cancer, it's just very difficult. There's not a huge survival rate out there, unfortunately, but hopefully with help from people like you, there will be other options for us in the future. So thank you very much.
Pardon?
So I had the same reaction yesterday that I'll share with you, which was, wow, my situation is dramatically different with my research. I got something in the mail that said, do you want a free Fitbit and a blood pressure medicine? If you want to be involved in a study, we'll send that to you. And having had some, I had some AFib and some other conditions, so boy, that sounded like a good idea to have more care and more knowledge and more tracking of my health and heart. So I signed up, and went through the study. It was very non-intrusive, pretty simple to do. Haven't seen the results. I don't know if it's finished. I don't really know where the stage is, so we'll find out. But it worked out. It was kind of really fun to be part of it and be part of the study. And I learned quite a bit because the purpose of the study was salt and blood pressure relationship. So now when I go to the store, I look at the salt labels and then I put the thing back down because it has way too much salt. So it's been very effective, but again, a much different spectrum of testing that I was involved with, and it's been fantastic.
Well, I'm sort of like a cross between the two of them. And this is for you, Bemidji. If you're not at the table, you're on the table. That's one of my mantras, and it brought me to the table. My mother had a stroke while she was caring for my children. And I was at work. This is years ago. So, that was my first experience with it. But one Sunday morning, my pastor, while standing in the pulpit, had a stroke right in front of us. And no one really knew what was going on. And several days after that occurred, a young physician who was just starting out then, Dr. Leslie Scaleras, came and talked to us about what she was seeing in the emergency room in reference to African Americans and stroke. And so she and I teamed up and decided this was something, because at the time I was also the co-chair of the Genesee County Speak to Your Health survey, and we had just gotten a report card back that showed that our health in Genesee County for African Americans was extremely poor, and especially in certain neighborhoods. And my thought is that if I team up with her and we talk about it and we alert the community about what's really going on, I've seen it happen, I've seen it in my home, I've seen it in my church, that I can get the community involved, and people need to know these things. And so my goal was to engage my church in first, as the first participants in the intervention. And then we spread to 3 other churches. And then we did something that was really strange. We went to a men's conference of whatever kind of gathering they were having, because men don't usually want to do anything medical. They just sort of like, no, you guys, you go talk to the doctor for me. No, you have to go to the doctor for yourself. So those kinds of things happen, but we went to a men's conference and we started talking about stroke, symptomology, things that you could do, and we had a line from here to, of men that just came up and signed up to get involved in it, and found out that there was some questions that men also have, and women have, and children have, and children often are left in the care of many adults, men, grandparents. But if they don't know what the symptoms are, you could have a stroke right in front of them and they would not know what to do. And so our goal was to get everybody involved and to have the community aware of what the stroke symptomology was. Nothing big, nothing, invasive, but just what the symptoms are. Because I think a lot of times for most of us, it's knowledge. We don't have the knowledge that we need in order to be able to be proactive for ourselves. And so we started this project in, I think, 2013. And we were able to, at the time that we started the project, the stroke ratios in Flint were poor. The recovery rate was poor. But we've actually been able to move the needle and increase the likelihood of people following through, getting proper treatment substantially. And I think that's because of the dedication that you have to have, not only as a participant, but also the dedication that's required of the researchers involved, that they have to know that people don't really care how much you know until they know how much you care. And so right in the middle of this whole process, we had something in Flint called a water crisis, in which lead was released into the drinking supply for the entire city, not a portion or a part, as in many other parts of the country, but the entire city was under this. And so Dr. Scaleras and her team came to Flint and helped us deliver clean, portable drinking water to people. And when people saw exactly how much she cared, that she would take the time away from her practice, that she would come to Flint, not just to get the research material, but to help the community to recover from a devastation, they decided that she's that lady. And whenever they see her, they say, oh, you're that stroke lady. And what kind of project you got going now? And that's how you get people to trust you in research. You have to show them that you care. And once again, I say, to the community, if they're not at the tables, they're going to be on the table.
Thank you so much. You touched on so much there, Reverend Bailey, and I love how you kind of said it. You've gone all the way from, I think, participant to really research leader in the community, and you're definitely a voice that we've oftentimes looked at when we, tried to work with community programs in Flint. And so, thank you for helping with that guidance. I'm curious, Barton, one of the things that Reverend Bailey was talking about is not only your own experiences, but that sometimes what she sees as kind of opportunities, but then also maybe, challenges with doing research. And do you want to speak a little bit about, was everything perfect, or what could we have done better as part of the research experience? What were some of the challenges that you might have experienced? And then Lori, the same for you, Ashley.
Challenges. I must say it was very organized, and I had an app that I interacted with. The study itself I thought was really well done. There was a lot good information on what I was supposed to do. My interaction sent me reminders. The only thing I really didn't ever receive was any progress was I doing it right or not? So I was just randomly putting data in. That would be my only kind of general feedback is maybe a scorecard or a meter that's green or red saying you succeeded or not. But in general, the purpose of being part of that test was I saw absolutely no negative connotation in this research. All I saw was the uptake, and that's why I signed up for it. And I thought it was fantastic, and if I learned something from it, which I did, that was a great takeaway.
Lori?
So for me, again, it's going to be quite personal. Bile duct cancer is quite rare, and so about 6 months post-Whipple, I was kind of noticing that I wasn't doing very well emotionally, even though I was feeling better. So I Googled, I think, Whipple in Facebook, and I found my Whipple survivor group. Then from there, I'm on a bile duct cancer support group for patients only. I'm in one for caretakers, and then I did HIPEC, so I'm on a HIPEC support group, and on and on and on. So for us, the challenge is getting the word out. And bile duct cancer is also called cholangiocarcinoma. There's different parts to that cancer. Like I have extrahepatic, so my cancer was not in my liver. More of cholangiocarcinoma patients, it is in the liver. So I don't really have anything in common with people who have it in the liver versus without. So it's really about crowdsourcing and sharing information. For example, I saw Dr. Sahai, my oncologist, on Monday, and I know that he saw a gentleman, I'm just gonna call him JP. JP was told he should try HIPEC surgery, and that Dr. Sahai had a patient that did very well, was doing very well post. Well, that was me, but JP doesn't know me. So JP in turn tells Sarah, and Sarah says, oh, I think I know who you're talking about. I think that's Lauren Robertson. So then she texted me and said, can JP call you? And I said, yes, of course, sure. So it's really about building the community post-trial and again, crowdsourcing. So Dr. Sahai is hoping that JP can get this HIPEC surgery and get his metastasis taken care of. So those are really the challenges. A lot of it is us as the patient sharing information, gathering information. But I do feel comfortable that if I do get my third reoccurrence, which, well, I guess second reoccurrence, which, you know, chances are it will happen, I could go to Sarah, who is the expert with liver. And for example, U of M just created a new procedure for liver cancer called histotripsy. So it's a lot like lithotripsy, where remember we could zap the kidney stones very easily, you know, many years ago. Well, now they think they can zap tumors straight from the liver, you know, without pain, very much with ease. So the technology is always out there, but our challenge is, how do we find out about it? You know, not everybody works for U of M, you know, they're not privy to all of that information. So the more that we share, the more vocal we are, the better.
I think one of the things that's been really interesting about the theme of communication, both like giving the findings back to the community or to the individual, to groups of patients, and it's something we think a lot about. And you know, it's certainly an area I think we need to all explore a little bit more. Your story is like really powerful in that regard. I wanted to just say thank you again to each of you for sharing. You know, I always learn a lot when I talk with all of you. Thank you for participating, and hopefully you've inspired others to convince other people to participate too, because I think it really is a wonderful community. And thanks again.